I'm here today with Dr. Marucci. Dr. Marucci is one of Sydney's leading and most highly trained plastic surgeons. Thank you so much for taking the time to talk to us today.
No, thank you very much.
Awesome. Now, you've got rooms in Cogra and you consult in Miranda as well.
That's right, yeah.
You're also a director of the Aesthetic Day Surgery facility where most cosmetic and reconstructive procedures can be performed on a day-only basis.
Yes.
Can you tell us why this is a good thing for patients?
The Aesthetic Day Surgery is a fully accredited private hospital. So what that means is that it has attained standards which are regulated by the government. It means that in terms of patient safety, there is no higher patient safety than one can have. Because it's an accredited private hospital, also it means that for surgical procedures that have an item number, and many plastic and cosmetic surgical procedures do have an item number attached for it, patients are able to get a rebate from Medicare and their health fund. At the day surgery, we have consulting rooms. We also have rooms where we have cosmetic nurses who do injection of anti-wrinkle treatments, Botox and fillers, and we also have a laser. So having everything all in the one place just makes things far more easy for me and for the patients. It's very discreet. It's not like if you're going into a very large hospital with people walking around and they can see who's who. Generally there's only one operating theatre, only operate on one person at a time. So it gives patients a degree of privacy, but also, most importantly, it gives them that quality assurance.
And the safety, all about patient safety.
It's all about patient safety. Everything we do is either under a full general anaesthetic. Sometimes we do things under sedation. Some cases, obviously, we can do under local anaesthetic. So we're not limited in terms of what we can do. When I first started out, I was a bit uneasy with certain cases doing them under as a day-only case. So there is a private hospital around the corner where patients need to stay in overnight, they can stay in overnight. But what I've found is that actually, as long as the pain relief is well controlled, both before and during the procedure, and obviously giving the patient adequate pain control afterwards, the patients have the option of going home and sleeping in their own beds. I give all patients my mobile number. If they've got any problems any time of the day or night, they can give me a call, and I can go in and see them and make sure there are no issues.
That's really reassuring because we're always getting calls afterwards saying, this has just happened, I can't get a hold of my surgeon.
Exactly.
And people go into meltdown. So.
Exactly. No, having a contact is very important. We actually have a nurse who, at the end of the day, what she does, she calls everyone. Sort of the evening of the surgery, make sure they're okay, make sure there are no problems. Because sometimes patients might have a problem, but they think, I don't want to call Damian about this. But then the nurse will say, look at everything. Actually, I've had a bit of dribbling or oozing or something, and then I'll give them a call, make sure everything's okay. There's nothing to worry about.
Perfect.
Yeah.
And I had another question that I wanted to ask you as well, if you don't mind.
Sure. No, it's fine.
Just a quick rundown of the surgical. Well, we know the surgical procedure, but the non-surgical. So when you say laser,
yes.
Is that for skin tightening, or what sort of laser do you have in the rooms?
We are very lucky. We have a Cutera laser. We're also very lucky. We have two of the best cosmetic injecting nurses in Sydney, Marilyn Cassetta and Janelle Kelly. They work out of a number of different plastic surgeons' rooms. We're very lucky to have them working in our rooms.
I've actually heard the Marilyn on the best injectors around ever.
Yeah, and she actually trains, and she actually trained the first plastic surgeons who started doing injecting in Sydney. So when it comes to Botox and fillers and the use of the laser, Janelle Kelly used our laser. Basically, I refer with great confidence.
Yeah.
So they do the full gamut of Botox and fillers. We work together, for example, for the areas around the eyes where I might be looking to do eyelid surgery, upper and lower, or both, and then I might get them to do the Botox for the glabellar frown lines with fillers, and then the crow's feet as well. Because of their expertise in injecting, to tell you the truth, I'm more than happy to refer patients on to them to have the Botox and fillers.
Do what you're good at and let someone else do what they're
Exactly,
good at.
because that's all they do all day, every day. Yeah.
I so agree with that philosophy.
Yeah.
All right, so we love that your practice is known for its relaxed and friendly atmosphere, which it's obvious, that's because of you, and the fact that you see your patients a minimum of twice before surgery.
Yeah, I think that's really important. Yeah, no, I think that's very important. First of all, the decision to undergo surgery, especially surgery which is very elective. So if someone has prominent ears, it bugged them for a long time. But it's a lot to take in, and in many ways it's a big decision to make. People always say, oh, but it's not major surgery, but as one of my patients said to me, any surgery on me is major surgery, and that is true. And so I think for that reason alone, it gives patients a chance to digest what I've said, and then for them to ask questions. People think that being a surgeon is all about operating. It's not, I mean, part of it is about operating and hopefully having good surgical skill, but a big part about it is communication. And the communication is very much both ways. I need to know what the patient wants. I need to know what the patient is concerned about. And then the patient needs to know what I can do and what is realistic and what is involved with the process. And often you can't get all of that across in one consultation. It takes 2 consultations. And I just think that's fine. I'm more than happy to do 3 consultations or 4 consultations. I'd rather have a patient who is well informed and who feels like all their questions have been answered and understands what I'm going to do and why I'm going to do it. The other thing about all surgery, but particularly with plastic surgery, is that you'll see fantastic results, but everyone does the surgery slightly differently. And that doesn't mean that other people are doing it wrong or other people are doing it right, but you find that for you, me doing this operation using this technique is what I do. And so it can be very confusing for patients. Obviously, many patients have seen a couple of surgeons. And they come along and see you and say, now what are you going to do? And I say, I'm going to do this, I'm going to do that. And then I think, I'm confused because I saw Dr. X, and Dr. X said not to do this and not to do that. And so it's important also that I explain and have the patient on board with what's going on. And so they understand not only what I'm going to do and how I'm going to do it, but they also understand the post-operative course, when I'm going to see them again, the whole thing about that it's contactable, and when the stitches come out, when the dressings come off, when they can go back to work or school, when the swelling's going to go down. I always say, oh, you know, make sure you don't have your nephew's wedding coming up 2 weeks after the surgery, all that kind of stuff.
Okay, so it's about keeping them informed.
Yeah, of course.
And we always suggest that people go and see, 2 to 3.
Yes, without a doubt.
And that way they can say, oh yeah, this feels right for me, or this doesn't.
Without a doubt. And because like the plastic surgery community is pretty small, we all know each other, and we are colleagues. On the one side of the coin, you could say we're competitive, but not so much that you would ever denigrate anyone else or say don't get a second opinion. And I think patients who've had a second opinion come along and see me. It makes my job a lot easier.
Exactly.
Because they already have had a rundown of what's going on, and often I will see patients who say, oh look, I've seen X around the corner, and I'll just say to them, look, he's a great surgeon. What he's told you is exactly right. I know you'll get a great result. And that's it. And a lot of it is reassurance.
Okay. And just one last thing. I know you're a regular blogger, and I love that you're active in Q&A with patients and people inquiring about plastic surgery procedures and what they should do and whatnot. Could you tell us why you think it's important in your role as a plastic surgeon to do that?
So much information is out there on the internet, and unfortunately a lot of it is wrong. When I think about my life, if I'm looking for some information, I'll go on Google and find it. And so patients are doing exactly the same thing when it comes to plastic and cosmetic surgery. So part of my role as a doctor is to be a communicator and is to hopefully be an educator. There are patients who may be too self-conscious about their concerns to ever actually go and see a doctor, and they may only feel comfortable by asking a question in the privacy of their own home in one of those question answer sessions. So this is a way for me to communicate with patients, educate patients, and I think for the individual person that you help, there'll be another 15 or 50 who also read the blog and also get the same benefit. And hopefully what I'm putting out there, obviously it's my opinion, but hopefully it's backed by science, and hopefully it's more correct than the information that they may have read elsewhere.
Absolutely, yeah.
And I'm always astounded by the number of patients who've read in a number of different sites something which is just wrong. The most common thing is you see patients who think that their breast implant need to be changed every 10 years. I don't know where that comes from. I don't know where it's come from, but it doesn't. Your implants don't need to be changed unless there's a problem.
Okay.
And
so they last forever?
They don't last forever,
okay.
but they stay
So
there.
okay.
If it ain't broke, don't fix it. It's fine. If you're happy with your implants and they've been there for, I saw a lady who's had her implants in for 35 years, no issues and no problems, and they do not need to be changed.
Yeah,
exactly.
30 years, and she's like, no, I don't have anything
exactly.
wrong, I'm not going to touch it.
Exactly. Yeah.
Awesome.
No
Well,
worries.
thank you so much for taking the time. We're here in beautiful Darling Harbour for the
Yes.
Rhinoplasty Symposium, so there's a whole heap of plastic surgeons here learning from each other. So
Yes.
thank you so much.
No worries. Thank you very
Awesome.
much.
Pleasure.